Today, we're talking about Succimer Capsule. This medication is used to treat lead poisoning by binding to the lead in your body and helping your kidneys remove it. By removing the lead from your body, it can lower the chance of severe problems caused by lead poisoning. The daily dosage and optimal timing for taking this medication will depend on your doctor's recommendation, so be sure to follow their instructions carefully. When taking Succimer Capsule, follow your doctor's instructions on how to take it. You can take it with or without food, every 8 or 12 hours. Swallow the capsules whole, but if you have trouble swallowing them, you can open the capsule and sprinkle the contents on soft food like applesauce. Swallow the mixture without chewing. You can also take it by placing the contents on a spoon and swallowing it with fruit juice. The dosage and how long you need to take Succimer Capsule will depend on your medical condition, how well you respond to the treatment, and your body size. It's important to drink plenty of fluids while taking this medication, unless your doctor tells you otherwise. Taking Succimer Capsule regularly at the same times each day will help you get the most benefit from it. Some common side effects of Succimer capsules include nausea, vomiting, loss of appetite, or diarrhea. If any of these effects persist or worsen, it's important to inform your doctor or pharmacist. It's important to remember that your doctor has prescribed this medication because they believe the benefit to you outweighs the potential risks of side effects. Many people using this medication do not experience serious side effects. However, it's crucial to notify your doctor immediately if you experience any serious side effects, such as signs of infection, like a persistent sore throat or fever. While very rare, a serious allergic reaction to this drug could occur. Seek medical help right away if you notice symptoms such as a rash, swelling, severe dizziness, or difficulty breathing. This is not a complete list of possible side effects, so if you notice any other effects not mentioned, it's important to contact your doctor or pharmacist. In the US, you can report any side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can report side effects to Health Canada at 1-866-234-2345. Before you start taking Succimer, make sure to let your doctor or pharmacist know if you have any allergies or if you have a history of kidney or liver disease. It's important to also inform your doctor or dentist about all the medications and herbal products you are using before undergoing any surgery. If you are pregnant, only use this medication if it is absolutely necessary and discuss the potential risks and benefits with your doctor. It is not known whether this medication passes into breast milk, but because it is used for lead poisoning and lead may pass into breast milk, it is advised not to breastfeed while using this drug. Always follow your doctor's recommendations for the best timing and dosage for your specific condition. When taking Succimer Capsule, it's important to be aware of any potential drug interactions. These interactions could impact how your other medications work or increase your risk for serious side effects. It's important to keep a list of all the products you use, including prescription/non-prescription drugs and herbal products, and share it with your doctor and pharmacist. Don't make any changes to your medication dosage without consulting your doctor first. Additionally, Succimer Capsule may interfere with certain lab tests, such as uric acid levels, CPK levels, and certain urine ketone tests, which could lead to false test results. Be sure to inform lab personnel and all your doctors that you are taking this medication. If someone has taken too much Succimer and is experiencing severe symptoms like passing out or difficulty breathing, it's important to seek immediate medical help. In the US, you can call the local poison control center at 1-800-222-1222. In Canada, residents can contact their provincial poison control center for assistance. Never share your Succimer capsules with others. It is crucial to eliminate the source of lead exposure. Make sure to consult your doctor or pharmacist for guidance on how to identify and avoid sources of lead exposure. While using this medication, it is necessary to have lab and/or medical tests done, such as a complete blood count, blood lead levels, and liver function tests. Remember to keep all medical and lab appointments and consult your doctor for more details. The daily dosage and optimal timing for taking Succimer capsules will depend on the individual's condition and the doctor's recommendations. It is important to follow the prescribed dosage and take the medication at the recommended times for the best results. If you forget to take a dose, take it as soon as you remember. But if it's almost time for your next dose, then just skip the missed one. Take your next dose at your usual time. Don't take extra to make up for the missed dose. When it comes to Succimer capsules, it's important to store them at room temperature away from light and moisture. Make sure not to keep them in the bathroom and always keep medications out of reach of children and pets. And when it comes to disposing of this medication, don't flush it down the toilet or pour it into a drain unless instructed to do so. It's best to properly discard this product when it's expired or no longer needed. If you're unsure about how to dispose of it, consult your pharmacist or local waste disposal company for guidance. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.